My dear friends, for this, in quotes, pastoral medicine course, we are bringing together for the first time the members of two distinct circles of spiritual work. This is of quite special importance. We must inquire, therefore, first of all, into the reason for the combination from the intended content of the course itself. In the first place, I would like to point out that perhaps this course, as no other, will be an example of how ancient traditions must be renewed through a particular form of spiritual activity in our time. For what has so far developed under the name pastoral medicine has really lost its original content. We will see that this is so in the course of our study. Yet, out of the very foundation of this present age, there arises a most significant task that, as it takes shape, may be allowed to bear the name pastoral medicine. We have made the strict requirement that this course shall be mainly for real theologians and real physicians, including those who are training to be real physicians, in the sense in which that title can be given them from the standpoint of the medical section of the Goetheanum. How this standpoint is to be understood will become clear during the course. We have admitted a few individuals who are exceptions to the general requirement, and these for reasons based on the opinion of the medical section of the Goetheanum. First and foremost, dear friends, there must be an absolutely clear understanding on the part of the theologians and on the part of the physicians for what is now going to be made possible by their working together, namely a new pastoral medicine. Their working together has indeed often been discussed. It has even been pointed out that the anthroposophical movement should try to bring it about. But then things have come to light which must be corrected precisely during this course. A proper working together must certainly not be understood to mean any dilettante interference by one side into the work of the other side. It certainly does not mean that the theologians are to become physicians, or that the physicians are to become in the slightest way theologians. It is purely a matter of the two professions working together hand in hand. The course will stress very strongly the importance of preventing any kind of confusion by, for instance, the theologian trying to get his hands into various medical measures that cannot possibly lie in his sphere of work. And on the other hand, the physician must be clearly aware of the position he must always hold, in the sense just described, toward the theologian. It is tremendously important that this should be thoroughly understood by both sides. Very, very much will depend upon it. Apparently the thought has even been entertained that the theologian should actually acquire medical knowledge. Well, of course, it is always good to acquire knowledge, but the important thing here is to realize absolutely clearly that the physician, in addition to the cultivation of his thinking, feeling, and willing, has had specific medical training. No one should play with the idea that he can push his way into the world with bits and pieces of medical knowledge without this specific medical training, even if he's a theologian. On the other hand, the physician must develop a special conception of his profession. He must learn through pastoral medicine that something essential is expressed when it is said, "The flame of offering belongs to the priest, the mercury staff to the physician." And only through the working together of the flame of offering and the mercury staff is a healthful cooperation possible. One must not want to heal with the flame of offering, or to celebrate ritual with the mercury staff. But one must realize that both are divine service. The more fully this is realized, the better will be their cooperation, with physician remaining physician and priest remaining priest. And the more healing will be their work in the world. Our anthroposophical movement must not be allowed to become an area where everything is thrown together in chaotic fashion. The seriousness that we should be cultivating so strongly within our movement would suffer thereby. One can have knowledge, if I may use an obvious example, of the general procedure for a foot operation, but one should certainly not think that therefore he can perform the operation. And this holds true for all medical matters. Above all, anthroposophy must not become propaganda for quackery. It must not be allowed to happen that the theologians become quacks. This must be understood very clearly. The medical section at the Goetheanum will handle with extreme seriousness whatever is going to give an individual a position out in the world as an anthroposophical physician. But the following must also become an established procedure: that a physician who wants to work with the same impulses as the medical section at the Goetheanum will have his status and his relation to the section properly defined by the section. There will be no progress unless this procedure becomes a complete reality, so complete, in fact, that in the future someone will be acknowledged as a physician if he has passed the requirements of the medical section at the Goetheanum. From this point of view also, dear friends, we are justified in not having admitted to this course healers who are not physicians. Those who sit here today, with a very few exceptions, can lay full claim in the outside world to membership in the medical profession. Perhaps we have made ourselves clear. I have been speaking more from the administrative angle, but the matter will be the concern of pastoral medicine itself. When the question was raised recently by the theologians whether something of a medical nature could be given them, I could not do otherwise than say that I would give a course on pastoral medicine, in which the theologians could participate. And so the course has been organized by the medical section of the Goetheanum, and the theologians are taking part in it. It must be quite clear why we have structured it in this way. Up to now, dear friends, pastoral medicine has not been a subject in the medical faculties, but in the theological faculties. And the pastoral medicine that has been taught in the theological faculties has really not contained anything specifically medical. Parenthesis, or perhaps I should ask, has any physician here who has gone through the academic training had any pastoral medicine in his medical courses? Please raise your hand. Close parenthesis. It is not offered in any catalogue of a medical faculty. It hardly appears any more in Protestant theological faculties, but it does have a role in Catholic theological faculties, and for a good reason. Only it contains nothing of a medical nature. In the main, it contains the following. First, knowledge the priest needs in order to work as a pastor, not only with healthy persons who are given into his care, but also with those who are ill. There is a difference whether one has the sole care of an ill person, particularly one who is seriously ill, or the sole care of a healthy person. With the ill, perhaps severely ill person, the question is how one shapes the sole care, how one relates to it. But I have never yet found a book on pastoral medicine that did not stress repeatedly that the first task of the pastor is to make certain, by word and deed, that a real doctor is found, and that he himself should refrain from all medical measures. I am just reporting on this matter. A second important subject of pastoral medicine has to do with the hygienic aspects of certain ritual measures. For instance, the healthfulness or unhealthfulness of fasting, required for ceremonial reasons, is explained for laymen. Also, what medical science has to say, for instance, about circumcision and similar matters. For the priest himself, this course has just to do with Catholic faculties. It sets forth clearly what is to be said from a hygienic standpoint about asceticism. This is spoken about very fully. A further subject has to do with what measures should be taken, for instance, in a parish where there is also a doctor, what connection there should be between the medical care and the sacraments. When a religious community bases its activity on the reality of the sacraments, we will speak about this later, it means that the priest must be prepared to meet the medical treatment that is being given. There is, for instance, the anointing that the priest must perform at the sick bed by the side of the doctor. We have also to consider what significance the earlier pastoral medicine attributed to a person's receiving communion while recovering from a severe illness. Looking at the spiritual aspect, one has to ponder on the working of the sacrament in relation to the processes of healing in a human being. A further subject, and this is discussed at great length, examines how the pastor has to relate himself to the physician in psychopathic cases, cases of mentally handicapped or psychically abnormal individuals. The pastoral work is varied for such cases. This was the principal task confronting pastoral medicine in its earlier days, and it was taken care of through the centuries rather extensively by calling on the authority of the Church Fathers' writings. That is a field of work that cannot appear in the same light to us, who are involved in a renewal of spiritual life. Indeed, from fundamental anthroposophical views, we are aware of very important tasks in that field for a new pastoral medicine. And, dear friends, we can discover the extent of such tasks if we consider the subject from two sides. First, let us consider it from the medical point of view. What are we doing when we apply a therapy? When we give a medicine or apply some healing measure to a sick person, there is always the fact that in the healing process we want to set in motion, whether physical or spiritual or pertaining to the soul, we are going beyond the so-called normal relation of that person to the world around him. No matter what therapy we use, in every instance we are going beyond what the person has normally in his everyday life, whether it is his taking of nourishment, or his exposure to light and air, or exposure to soul influences. In every circumstance, we are going beyond all of that in our therapy. Even if we simply prescribe a small change of diet, we have gone a small step beyond what the person himself had permitted in his everyday relation to the world around him. Say that we prescribe a medicine. If it's a physical substance, its effect will be that a different process takes place than would take place if he were merely eating food. And it is the same with other therapeutic measures. In using any therapeutic measure, we are intervening in the life of the patient in a way that is different from the way life usually works upon him. For what is the normal intervention in human life? How does a human being take hold of his life himself? We can distinguish, dear friends, three kinds of processes that intervene, or can intervene, in human life. First, the process that is active in the human being in the same way that physical chemical forces are active in outer nature. Secondly, the process that is active in the realm of a human being's life forces, in life itself. Thirdly, the process that takes immediate hold of the human being in the sphere of his consciousness. Again, 1, physical chemical, 2, life, 3, consciousness. Here we must grasp an important concept. In ordinary life there are 3 states of consciousness: waking, dreaming, and sleeping. The moment we apply an active therapeutic measure, we are intervening in the sphere of consciousness, to a greater or lesser degree depending on what the measure is. Such intervention never occurs in such a direct way in the so-called normal course of life. When a person is eating, for instance, he is surrendering to the usual process of taking nourishment. Then, if this has proceeded normally, there follow his waking, dreaming, sleeping in normal fashion. At the most, we might vary his diet for the purpose of bringing about better sleep, but there the boundary is already shifted. Therapy has already begun. It is quite another matter if you intervene with some therapy when, for instance, a patient has a fever. If you were to apply the same therapy to a healthy person, you would alter his condition of consciousness. Thus, a physician has to work fundamentally with the various states of consciousness. A human being's ordinary relation to the outer world has to do with life forces. But in medical work, one is intervening in the states of consciousness. You will find this is so in every single therapeutic measure. And it is the specific characteristic of a therapeutic measure that it does enter into what has to do in some way or other with the variability of consciousness. In fact, the only effective therapy is one that takes such deep hold of our human constitution that it penetrates to the source from which our various states of consciousness come. But thereby you are intervening as physician, as therapist, directly in the ordering of the spiritual world. Your alteration of someone's condition of consciousness means that you are intervening directly in the ordering of the spiritual world. And when you have a really active cure, you are always, through this penetration into the state of consciousness, even though it may be into subconsciousness, you are always drawing the soul of the person into the therapeutic process. You do not remain in the physical sphere. Our ordinary consumption of food, ordinary breathing, our other ordinary processes remain in the physical sphere, and our higher members work indirectly through the physical sphere. Our higher forces are active through our physical organism. In contrast, when you are working as a physician or therapist, you draw the patient's soul directly into his physical body. Indeed, we can say, if a physician understands his profession properly, he realizes that he enters directly into the realm of the spiritual. It only seems that therapy is merely a physical or biological process. True therapeutic measures always involve the patient's soul, even though at first this may remain unknown to the ordinary consciousness. You should observe, dear friends, what actually takes place in a patient when, let us say, his fever is suddenly lowered by some therapeutic means. In this event, processes are introduced into the innermost depth of the patient's being, just as the illness itself had worked into this depth, beyond the merely physical and biological realm. So, we have looked at the picture from the medical point of view. We have seen how doctoring, healing, by its very nature, leads from the physical realm into the spiritual. Now let us examine the priest's profession just as carefully. If the priest's calling is not one of teaching, if he is a truly active priest, then he is connected with the ritual, and the ritual includes the sacraments. But the sacraments are not symbols. What are they? They consist of this, that external events take place, and these external events hold something in them that does not exhaust itself in chemical or biological processes. They contain orientations which are embodied in the physical, biological sphere, but which have their origin in the spiritual world. Sense-perceptible actions are performed, and spirit streams into the actions. Spiritual reality is present in the ritual on the level of sense perception. And what takes place there in front of the congregation takes place first of all before their conscious observation. Nothing is permitted to take place except what does take place in that way. Otherwise it would not be ritual, not sacrament, but suggestion. The sacraments, if they are right, are never allowed to contain any element of suggestion. All the more, therefore, they are able to contain what is spiritual. They take place before the waking consciousness of the participants, but they work into the sphere of the life forces. In the communion, a person is not just eating the material substance that is offered to him. In that case, it would not be a sacrament. Also, it is not a matter of symbols. Rather, it has to do with reaching into a person's life, because a sacrament is enacted, is celebrated out of an orientation from the spiritual world. Therefore, one can say, therapy leads from life to consciousness. The ritual with its sacraments leads from consciousness to life. Again, therapy, life to consciousness. Ritual, sacraments, consciousness to life. There you have the two activities in polarity: therapeutic activity and the celebration of the sacraments. In therapeutic measures, the course leads from life to consciousness, and consciousness becomes a helper, at least in ordinary consciousness, an unconscious helper in the healing process. In the celebration of the sacraments, life is made a helper for what is enacted before the consciousness. Both of these activities, dear friends, have to be grasped spiritually, in deep inwardness, not merely diagrammatically as it is now being presented to you. They require the involvement of the total human being, if that individual wants to make one or the other his vocation. Only because in our present civilization therapy has left behind the spiritual element, and theology has left behind the concrete world, only because in our present civilization therapy has taken a false path into materialism, and theology a false path into abstraction, only for these reasons has their true relationship become completely veiled. This true relationship must be re-established. It must become active again. Again, it must become clear that the physician needs already for his diagnosis a trained observation that enables him to see a biological or even just a physical process in the human organism as actually a spiritual process. For all processes in the human organism are spiritual. The physician needs already for diagnosing, and still more in his treatment, an observation that is trained to see the lighting up of the spirit within the physical. The priest needs an observation that is trained to see the lighting up of the physical reflection of a spiritual event. There is a polarity again. But there must always be polarities working together in this world, and these are no exception. To see how they are to work together will be a task within the sphere of anthroposophy, and based on anthroposophy, a task also to be fulfilled within anthroposophical spheres of activity. So one can think, dear friends, that out of this gathering for a pastoral medicine course, there may actually be created the future anthroposophical physician, who will hold the right relation to the priest because of his own relation to the spiritual world, and that the priest himself will have come out of the movement for Christian renewal. Something quite special will develop out of this course for the physician and the priest, so that they will work together in a true way. For what, in this case, can working together mean, dear friends? Surely not that the priest does dilettante doctoring and that the doctor does dilettante priesting. That it cannot mean. For if their working together were to consist of the priest knowing a few medical facts, and the physician vesting himself as a priest, then I'd like to know why they should work together. Why should an experienced physician be interested in half-priest, half-doctor dilettantism? It makes no sense. And why should a priest want to interfere in medical matters, except at some moment when the physician asks for a pastor? On the other hand, if the physician is a good physician, standing squarely within his medical profession, and if the priest is a real priest, then they can work together. It means that one offers help to the other out of his own professional abilities, not that one pushes his way in to the other's professional domain. Such an association will bring about a profoundly important result for our culture. The physician will truly understand the priest, and the priest the physician. The priest will know just so much about doctoring as he needs to know, and the physician just so much about the vocation and mission of the priest as he needs to know. And then in time we will see to what extent physician and priest can work with the teacher to accomplish something beneficial to humanity. That will again be a special task. In that area, too, people will have to work together, and in the most manifold ways, because pedagogy is also something that must be looked at from a fresh point of view. The priest cannot be a physician, nor the physician a priest, but they can both, in a certain sense, be teachers. All the details, however, of these new associations will have to be thought out quite concretely. Therefore, I would like to ask you from the very beginning, today, to count as part of all that this pastoral medicine course is going to present, to count this earnest request, that everything be worked out on a really professional and expert basis. Then the priest will truly help the actual physician if he rejects all thought of medical dilettantism. That will be one of his responsibilities. And the physician will be able to do very much at the sickbed to bring the priest's mission to proper fulfillment, precisely at the sickbed, where often a priest has to intervene in life in a really essential way.